Hello, my name is Emma Vreeken. I work for Universal Diagnostic Testing as a patient care coordinator. UDT is both a sleep laboratory and a CPAP therapy clinic. I'm here today visiting with Dr. Paul Binks. Dr. Binks is board certified in both sleep medicine and behavioral sleep medicine. Dr. Binks, I've often heard you talk about sleep apnea, saying that it's a chronic disease that's treated like an acute event. So can you explain to me a little bit about what you mean by this?
Thank you, Emma. What this means is that obstructive sleep apnea, central sleep apnea, and other sleep disorders are chronic conditions much like diabetes or other medical conditions that we see. Treatment is long-term. Unfortunately, many people, when they're first set up with treatment, such as with CPAP, are seen once and then they're not seen again. When they come back to the sleep lab, they have no idea how to use their equipment, their equipment's worn out, or maybe they need a different mode of therapy or pressure setting. Here at the sleep lab and CPAP clinic, what we strive to do is follow people regularly to make sure that their treatment is effective over the long term.
So Dr. Binks, I know that a lot of our patients have been doing home sleep tests while wearing their CPAP machines. Do you feel like the data that you're receiving from these home sleep tests is sufficient enough to determine whether their CPAP therapy is working?
Yes, Emma, I do. For the vast majority of cases, home sleep testing is effective. It's also cheaper and more convenient for patients. In the vast majority of cases, we can determine whether or not CPAP is an effective treatment at that point.
That sounds really great. So now that we have this new technology, how often do you feel that patients with sleep apnea should be seen in our lab?
Emma, for most patients, I would say about once per year. That's assuming that they have no complaints and they seem to be tolerating using their equipment well. For other patients who are not tolerating their equipment or they are not feeling well, we suggest they come as often as needed until they feel better or they feel like their equipment is working for them. For some patients who have more health problems, such as chronic pain patients, people with other respiratory disorders, or maybe a more complicated medical history, we suggest probably about every 6 months.
Thank you so much for meeting with me today, Dr. Binks. This has been really informative. As you can see, we are able to treat anybody who is currently on CPAP therapy or should be using CPAP therapy. If you would like to call and make an appointment with us, or even if you just have a question for us, please give us a call at 801-938-5362, or you can call our toll-free number, which is 888-503-0038. Also, please take a moment to review all the useful information that we have provided on our website, which is located at www.sleeptherapyutah.com.